Cerebral palsy is a complex neurological condition that affects movement, posture, and coordination. It's a lifelong disorder that occurs due to damage or abnormal development in the brain, either before birth or during early childhood. The term cerebral refers to the brain, while palsy means weakness or problems with movement. So, essentially, cerebral palsy is a disorder that impacts a person's ability to move and maintain balance and posture. This condition affects people differently. Some individuals might have minor difficulties. So, they may walk with a slight limp and sometimes struggle with tasks requiring fine motor skills. For instance, buttoning their shirt might take a bit longer than most people, and their handwriting tends to be a bit messy. But overall, they can live independently. On the other hand, other individuals may face significant challenges with movement and require assistance with daily activities, from eating and dressing to even repositioning themselves in bed. It's important to note that cerebral palsy is not a progressive condition, meaning it doesn't worsen over time. However, the symptoms can change as a person grows and develops. So, how common is cerebral palsy? Well, cerebral palsy is the most common motor disability in childhood. Worldwide, it affects about 1 in 500 children, with slight variations depending on the country. In the United States, for example, it's estimated that about 1 in 345 children have cerebral palsy. This prevalence has remained relatively stable over the past few decades, despite advancements in medical care. Types of cerebral palsy. There are several types of cerebral palsy, each classified based on the type of movement disorders they cause. Number 1. Spastic cerebral palsy. This is the most common type, affecting about 80% of people with cerebral palsy. In spastic cerebral palsy, muscles are stiff and tight, leading to difficulties with movement. This type is further divided into subtypes based on which parts of the body are affected. For instance, spastic diplegia primarily affects the legs, while spastic hemiplegia affects one side of the body. Spastic quadriplegia is the most severe form, affecting all 4 limbs, the trunk, and the face. Number 2. Dyskinetic cerebral palsy. This type is characterized by involuntary movements. These movements can be slow and writhing or rapid and jerky. This type of cerebral palsy can make everyday tasks challenging. Eating, for instance, becomes tricky when your hand might suddenly jerk just as you're trying to bring a spoon to your mouth. Number 3. Mixed cerebral palsy. Some individuals have symptoms of more than one type of cerebral palsy. For instance, someone might have the muscle stiffness of spastic cerebral palsy in their legs, but also experience the uncontrolled movements of dyskinetic cerebral palsy in their arms. Causes of cerebral palsy. In many cases, the exact cause remains unknown, but we do know that it results from abnormal brain development or damage to the developing brain. This can happen before, during, or shortly after birth. Premature birth is a significant risk factor for cerebral palsy. Babies born before 37 weeks of gestation are at a higher risk because their brains are not fully developed, making them more vulnerable to injury. Multiple births like twins also carry a higher risk of cerebral palsy, particularly if one of the babies dies before birth or shortly after. Infections during pregnancy can also increase the risk of cerebral palsy. For example, rubella, cytomegalovirus, and toxoplasmosis can all potentially harm the developing fetal brain. Lack of oxygen to the brain during pregnancy or birth, which is known as asphyxia, was once thought to be the main cause of cerebral palsy. While it can contribute to the condition, it's now believed to account for only a small percentage of cases. Complications during labor and delivery, such as detachment of the placenta, uterine rupture, or problems with the umbilical cord, can also sometimes lead to brain damage, resulting in cerebral palsy. After birth, traumatic brain injury in the early years of life can also lead to cerebral palsy. This can occur due to accidents, falls, or abuse that results in damage to the brain. Symptoms of cerebral palsy. The first signs of cerebral palsy usually appear in early childhood. Parents or caregivers might notice that their child is not reaching movement milestones, such as rolling over, sitting up, or crawling, at the expected ages. In some cases, especially with milder forms of cerebral palsy, symptoms might not be noticeable until the child is a bit older. Movement difficulties are often the most noticeable sign of cerebral palsy. Walking can be challenging, with some people developing a distinctive gait. They might walk on their toes, have a crouched gait, or a scissored gait, where the knees cross in front of each other. Muscle tone problems are another common in cerebral palsy. Some people experience hypertonia, where muscles are too tight and stiff. This can make movements jerky and difficult, and might also cause cramping or aching, especially after physical activity. Others might have hypotonia, where muscles are too relaxed and floppy, making it hard to sit up straight or hold a position. Many people with cerebral palsy experience difficulties with fine motor skills. Tasks like writing, buttoning a shirt, or using utensils can be challenging and may require a lot of focus and effort. Speech can also be affected in some cases of cerebral palsy. The person might have difficulty controlling the muscles used for speaking, resulting in slow or slurred speech. Some individuals with cerebral palsy may also experience sensory issues. They might be overly sensitive to touch, light, or sound, or they might have difficulty with depth perception or visual tracking. Diagnosis of cerebral palsy. Diagnosing cerebral palsy is not always straightforward, especially in infants. When cerebral palsy is suspected, doctors will perform a thorough physical examination. They'll assess the child's motor skills, muscle tone, posture, and reflexes. They'll also take a detailed medical history, including information about the pregnancy, delivery, and early infancy. Doctors often use brain imaging to get a closer look at what's going on inside. They might order an MRI, which is like taking a super detailed 3D picture of the brain. This can show if there are any areas of damage or abnormal development. Sometimes they'll use a CT scan instead. This is another way of getting pictures of the brain, but it's quicker than an MRI. For really tiny babies, especially those born prematurely, doctors might use a cranial ultrasound. This is a gentler option that can be done right at the baby's bedside. Depending on what they find, doctors might want to do some additional tests. They might check the child's hearing and vision, or do some blood tests to rule out other conditions that could be causing the symptoms. In some cases, they might even suggest genetic testing, especially if they suspect there might be a genetic component to the child's condition. It's worth noting that diagnosing cerebral palsy can be a process that unfolds over time. Doctors might need to monitor a child's development over several months or even years to confirm the diagnosis and determine the specific type and severity of cerebral palsy. Treatment for cerebral palsy. While there is no cure for cerebral palsy, various treatments and therapies can help manage symptoms and enhance function. Physical therapy is often a cornerstone of cerebral palsy treatment. It focuses on improving movement, strength, and flexibility. A physical therapist might work with your child on activities like walking, balance, and coordination. They might also recommend assistive devices such as braces, walkers, or wheelchairs to help with mobility. Medications also play a crucial role in managing various symptoms of cerebral palsy. If more than one muscle group is too tight, doctors might prescribe oral muscle relaxants. Botox injections are sometimes used to temporarily relax specific muscles, which can be particularly helpful in managing localized spasticity, which is when one muscle group only is tight. Speech and language therapy can be crucial for those with cerebral palsy who have difficulty with communication. This therapy can help improve speech clarity, develop alternative communication methods if needed, and address swallowing difficulties. Occupational therapy is another important aspect of treatment. It focuses on helping individuals with cerebral palsy develop the skills needed for daily living, such as dressing, eating, and grooming. Occupational therapists may also work on improving fine motor skills and hand-eye coordination. In some cases, surgery might be recommended. Orthopedic surgery can help correct bone abnormalities, lengthen muscles, or release tight tendons. In severe cases of spasticity, a surgical procedure called selective dorsal rhizotomy might be considered, which involves cutting some of the sensory nerve fibers that contribute to spasticity. As research continues, new treatments and interventions are being developed. Stem cell therapy, for example, is an area of ongoing research that shows promise for potentially repairing damaged brain tissue. While still experimental, such advancements offer hope for improved treatments in the future. Now, we want to hear from you. Do you or someone you know have cerebral palsy? What treatments did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.